Okay, I don't know if you've heard this story, but it's a little insane. This couple has been struggling with unexplained infertility for 8 years, and within the span of 3 months, they went from having 0 babies to 4. So after years of failed medicated IUIs and IVF cycles with her own eggs, they decided to go the adoption route. And as they were going through that process, which is not straightforward, a lot of the times it has twists and turns and sometimes things fall through. So as they were going through the process of applying to adopt, they also were pursuing treatment via embryo adoption. Some of you may not be familiar with the process of embryo adoption, but it's unlike donor egg or using donor sperm. The embryos have already been created, and this can be done through IVF clinics, through designated agencies that handle embryo adoption and donation, and also through personal connections if you know someone that has embryos and they're willing to donate them to you. So they actually failed their first transfer using the donated embryos, and so they attempted again, and this time they were more aggressive and transferred 3 embryos. And the article that I read states that the decision was made to transfer 3 embryos because of concerns about embryo quality. Now, I don't know anything about these embryos, if they were genetically tested, the age of the woman whose eggs were used to create the embryos, or what the grading of the embryos were. All of these are important factors to understand the rationale behind transferring 3 embryos. But at the end of the day, all 3 implanted, and this is a picture of her being pregnant with triplets and about to deliver. And the babies were born at 30 weeks, about 12 weeks after their adopted daughter entered their family. So within the span of 3 months, they went from 0 to 4 babies. 1 was an adopted child, and 3 of them are still in the NICU, hopefully going home soon, but born at 30 weeks, which is not surprising when you think about the really significant risk of preterm, especially very preterm delivery when you carry triplets. Look at the data. 2/3 of triplet pregnancies in this country will deliver before 34 weeks, and 1/5 in twin pregnancies will deliver before 34 weeks, compared to 2% of singleton pregnancies. This is exactly why we as a field have become a lot more strict about how many embryos we transfer into a patient at a given time. We rely on the American Society of Reproductive Medicine for these guidelines presented here, where we look to the age of the eggs that the embryos came from, and we look at factors related to the embryo, like whether it's cleavage stage. We know that day 3 embryos don't do as well as blastocyst stage or day 5 to day 7 embryos. So for cleavage stage, you can see that there's a lot more that is allowed in terms of having multiple embryos transferred. But when you look at the blastocyst stage embryos that are day 5 to day 7, if it's a euploid or genetically tested embryo, we're always going to recommend transferring 1, because regardless of the age you are, when you made the embryos or come back to do the transfer, the chance of a genetic normal euploid embryo implanting is very high. But as you go up in age of the egg that was used to create the embryos, it's more permissible to say, okay, there's a higher risk of this embryo if it wasn't tested being abnormal, so let's put back more than 1. So you can put back up to 3 if you're over the age of 41, and these are unscreened embryos. Having said all that, I'm extremely happy for this couple. They've been through a lot, and I hope all continues to go well with them and their babies. I just wanted to take a moment to explain this kind of confusing headline and to use it as a teaching point.